tell me what support or information you received prior to attending the group?
Prior to attending
the group, yeah.
I didn't personally receive any information. That went straight to Janet and Terry. I just agreed to come along because Terry had to stop driving, and I agreed to accompany them just so they felt they had some support.
Okay.
And I was just coming along as a companion,
okay.
although I am very close to them on a daily basis.
Okay. Do you feel for you that attending the group has been of benefit?
For me, yes, because I was able to take the information I got here home to the rest of the family and share it with the rest of the family, like the grandchildren. My husband, who is Terry's son, because he wasn't very keen to actually accept Terry's illness. So I was able to leave the leaflets on the kitchen table, and he just read them in his own time, and he's now become more accepting as well, so that's helped him.
Good.
My attendance has helped the rest of the family as well.
Good, that's great. Do you feel that attending the group with other carers, that's allowed you to gain some support?
Oh yes, because we had a brilliant laugh, we had great fun, and it's made it, I actually missed it on a Friday morning when it came to an end. I thought, oh, we used to have such great laughs, you know, we were all in the same kind of boat, if you liked, and we were all able to share experiences. And it wasn't doom and gloom, there was a lot of fun. We spoke about making cocktails and baking cakes and other things, as well as the dementia, the serious side of things, but
great.
It was good.
Okay,
definitely.
I'm glad. And did you feel that was an environment that you were quite comfortable to share any concerns if you had any?
Yes, because you felt you weren't going to be judged by anybody, no matter what experience you brought up or what you said. Everybody was just so supportive. And the other thing was the other carers were able to input. If we raised a problem we've had, it's maybe been a problem they've had to deal with, and they gave their experience, and that could be a solution to a problem. So sharing each other's problems was quite good from the point of view that we stole some ideas of other people on how to go about things and manage things on a daily basis.
Good, I'm glad. After your husband started to attend the support group, did you notice any difference in how he coped with his condition?
Not as such. When he came, he was a little, I should say, apprehensive, wondering what it was going to all be about, and he was a little bit nervous about it. But after we'd been a couple of times, I think, of course, we went in the other room, they stayed patients in another. I think he did begin to open up and speak out, but I think he found it very difficult for the first couple of weeks. But he did enjoy it, but it took a little bit of getting into, I think, for him.
Do you think after he came along he was more aware of services that he could contact for support, or would that more be your role?
Yes, I think that's something that he tends to think, I'll take care of, yes. Okay. He knows about it and he's interested, but he thinks Janet will sort that, yeah.
Do you think there were particular sessions that he enjoyed more than others?
Well, having been in a different room, it's a little bit hard to know whether he did or not. I remember one time he said that they'd been asked to pick out pictures. There was pictures, paper, you know, different things. Some would take one, some wouldn't. And he picked out a caravan. And I think it was Ruth, taking his group, said, "Why have you chosen that, Terry?" And he said, "Because we used to have a touring caravan." And he remembered all the holidays going away. We had one for about 20 years. And it brought back memories that we'd done caravan holidays. So she said, "Oh, that's very good." You know, it was something he associated with the past and what a pleasure he'd had doing these holidays. Yeah.
That's lovely. That's a really nice story. Okay, probably move on to some questions more about your experience of attending the groups.
Yeah.
So, can you tell me what support or information you received prior to attending the group?
Well, it was Annie Gibbs that came to give us his diagnosis that brought me a lot of leaflets, different leaflets and books all about dementia when she came to the house to see us. And one of the leaflets was about carers and a course for patient and carers for 6 weeks at the community hospital. And she asked if we would be interested. And I said, yes, we would. That's how we found out about it.
Thanks.
And then she said they will write to you when one is available. They will inform you. And that's why it happened.
That's great. So Annie, if you could remind me, who is Annie?
Annie Gibbs is a community nurse here.
Community nurse.
Yes.
Okay.
Yes.
Okay.
She came to see us at the house, give Terry a test and all that, and then she came back about 3 weeks later to give us the diagnosis
Okay.
that yes, he did have vascular dementia.
Okay. Thanks for that. I'd like to move on to ask you about your experience of attending the group and if you felt it's been of particular benefit to you as a carer.
Yes, it has. Yes, definitely. Because although I suspected my husband hasn't been well for some time, perhaps a year, even perhaps a little bit more, I knew something wasn't quite right. But when you still get that diagnosis, it is one big shock. You just think, well, I've been expecting this, but it's not what I wanted to hear. And it's a little bit of accepting it yourself initially, and then you've got to move on and think, right, I've got to do all we can to help him. And coming to the course, I got to know such a lot of information. People with their husbands, their mothers, whatever, they were here for the same thing. And you think, well, I'm not alone. This is not only me coping with this. There's a lot of people got this to cope with, and to being diagnosed every day.
Absolutely. So it certainly has
Yeah,
been a
certainly,
benefit
yeah,
to you.
definitely, yeah.
I'm glad of that. Were there particular sessions that you found useful?
Well, I found all of them useful actually. I mean, it was something a bit, there was one session I was very sorry I had to miss because I had a hospital appointment myself and I couldn't make it, and it was the week when I think the lawyers were coming to talk about power of attorney and all that. I was given leaflets and all information by the ladies here, but I was sort of sorry that I just missed out on that one, hearing the people come from the solicitors or wherever they were coming in from to give you the information. But that's something that we're going to do in the very near future.
Did you feel comfortable sharing your thoughts in that group setting?
Aye.
Yeah?
Yeah.
And speaking to other people?
I opened up after a couple of weeks.
Good, good.
Very quiet, but after a couple of weeks I got chatting.
That's good. Can you remember if there were any sessions that you found particularly useful when you came along?
Well, all of them.
Yeah.
Can't pinpoint just one.
Uh-huh.
But power of attorney, I looked at that one.
Okay, good. So that was allowing you to plan for things
Aye.
further down the line, okay?
I can't handle money now. I don't handle money.
Okay.
So I've done silly things with it, you see. I give it away.
Okay. Generous.
Uh,
Generous with it. So does your wife help with that now?
oh, aye.
Good.
Very good. I can use the cash machines, but if something's if something's £2.50, get my wallet out, I get a £10 note, and I get another £10 note, that's £2 to me, then 50, get a £5 note,
Okay.
well that's £25, you see.
Okay.
I can't,
That's okay.
doesn't sink in.
Yeah. So you're using money
So if I
and
go
not
down
sure
town,
about the
if I
amounts.
go down town, I just take £10 with me, that's all.
That's fine.
You know, if I'm on my own, I just take £10.
So it's nice that you've got your wife there
Oh, aye.
to help with that side of things as well then. Good, good. Has attending the group made any difference to you and how you go about things day to day?
No, not really.
You do anything differently now to how you did it before?
No.
No. Okay. What about your wife or your daughter-in-law that came along to the carers group? Do you feel they do anything differently now since coming along?
She got shout at me, Adele.
Can you say that again?
She don't shout at me a great deal now. She understands.
Okay. So do you feel possibly the group has helped her to be a bit more understanding of the condition?
Yeah.